Mr. Chairman, thank you to you and Ranking Member Neal for hearing this hearing. Mr. Secretary, welcome back to Ways and Means. It's great to have you back. I want to praise the work that you have done and CDC and SAMHSA on suicide prevention. As always, there's a lot more work to be done, but I'm really proud of this administration's budget, your intent to take suicide seriously. And the $80 million directed just to the suicide prevention program at CDC for fiscal year 2024 is just wonderful. You know, one of the biggest pieces has been the transition to the lifeline to the 988 number, and you mentioned it in your opening statements. Thanks, by the way, to Mr. Moulton, a Democrat, and Mr. Stewart, a Republican, their leadership on this issue. And we successfully secured funding to help that transition last year. But, you know, when it went into effect in July, there was a huge surge in August in that number. And right now, I think SAMHSA expects calls to double in this next year as word is getting out about the 988. And one of these pieces of this conversation is trying to get an awareness campaign going for the new number and for suicide resources broadly, because how we treat it today is much different than when we were kids. And this, by the way, was something that Governor Gianforte and Mr. Kinzinger both partnered with me on in years past. And I was encouraged to see that this year's president's budget called for an awareness campaign similar to the bill we had last year, the Campaign to Prevent Suicide Act. Can you just speak to us as the leading healthcare official in this country about why this is so important?
Congressman, I don't know if there's anyone in America who hasn't lost a loved one at some point because of suicide, drug overdose. It is amazing to see the age of some of the people who are calling into 988, children, preteens. You hear the stories from parents about how they're not sure what to do, that their kids are suffering. You hear the stories directly from the children. America is hurting. COVID didn't create it. It just really exposed some of what's going on. And the president is very committed to 988 because it is a way to say to them, to people who are hurting, we're here, we're listening, and we're here to catch you. And thank God, working with all the states, we were able to stand up a program that actually works. And now the president wants to continue to double down, do even more, and I hope you'll help us with that because we want to do Absolutely. 6 million additional contacts.
Great. Thank you. One more question. I'm intensely interested in looking how we can decrease costs within the healthcare system. And AHRQ, ARC, a foundational agency that helps tackle much of this work. Yes. And I've been particularly interested in the role of all payer claims databases. You know, state after state have picked this up, and wonderful to have all that data to pull together state by state. But what we really need is a federal all payer claims database that bring this all together. And I know your budget looks at supporting this work within ARC. Can you speak to what you might see as the benefits of an all payer claims database on a national level?
We'll get to see what every country is doing better, and we'll get to pass along the best practices to every part of the country, because by collecting data and having it from all parts of the country, we can let folks see what's working and what's not. But if you're never seeing the data, you'll never know the success stories or the failures, and we'll continue to make the same mistakes. And so we're hoping that we can do a far better job of collecting that data nationally, because there's so much data out there now. It's just that we don't have, in some cases, the authority, or in some cases, the capacity to collect it. But boy, if we were able to collect it, Congressman, the stories we could tell, and the